What's going on today is we're coming out here in protest for the lack of PPE. Kaiser is following the CDC standards, which are the lowest guidelines, and we want them to follow the highest standards, which is following airborne standards for COVID-19. Just because those standards are set by the CDC doesn't mean that the employer has to follow them. They can follow the highest standards and keep the nurses safe.
We use what's called the precautionary principle as nurses, which means until you know what the best practice is, you should follow the highest guidelines and highest protections for your healthcare workers until you have scientific proof that it is safer to downgrade those protections. In departments where we are using the full gear, we have not had an outbreak of sick healthcare workers. In other units where all they have been given is a droplet mask or no protection at all, that is where we are seeing a lot of our healthcare workers and a lot of our nurses come down with this illness. We have 9 or 10 nurses that are known to be sick. We have many more that have symptoms but have not yet been tested for some reason or another. And then we have another larger group of over 50 of our nurses that we are monitoring because they've been either told or they know for sure they've been exposed to a positive patient. Our employer keeps telling us, like many others, that they have the supplies, but that they want us to be quote unquote good stewards of those supplies and reuse them, which is outside of any of our infection control protocols that we've ever had to follow before. And we know that it's unsafe and that we're going to spread this disease even amongst ourselves and our patients. So what we're hoping to accomplish is, if they truly do have the supplies, that they release them to us now before any more of us get sick. We do not want to get sick, and not only that, we don't want to take it home to our families. A lot of us are having to self-isolate. Many nurses have chosen to stay in hotels to stay away from their families, those that can. Many of the nurses are young female nurses that have small children at home. They have babies, and they don't have the ability to isolate and lock themselves away from their families. So every day that they go home, they risk giving this to their families and to their communities. These are nurses that are currently off shift or between shifts. And these are all nurses that work in the inpatient hospital, as well as some nurses from the emergency department and our labor and delivery department. So every single inpatient unit is represented out here today. And we're all saying the same thing: give us our PPE.